has should not be studied in isolation. It should have been studied in a very compact, very what I say, an interdisciplinary manner. Only then we could understand the gravity of the situation. Why we are not able to understand the gravity of situation? Because we have not seen China from Chinese prism. We have also not seen WHO from WHO's prism. And we have also not seen India from the prism, we should see, from an Indian prism, like the way India is tackling this problem, and the way world is tackling this problem. You know, this pandemic has brought us into a very difficult situation where we are also questioning impact of certain organizations who have been a part of our global history, and also were predicted as the path breaker of the world. ना किसी ने डाउट नहीं किया होगा कि WHO जैसी ऑर्गेनाइजेशन पर कभी कोई इस तरह की क्रेडिबिलिटी का संकट आएगा। शायद हमने कभी गौर भी नहीं किया क्या WHO इस तरह की ऑर्गेनाइजेशन हो सकती है जिसपे क्रेडिबिलिटी का कोई संकट आए, या जिसकी क्रेडिबिलिटी किसी भी रूप में क्वेश्चनेबल हो। इसलिए ये बड़ा इंपॉर्टेंट हो जाता है कि हम समझें कि ये किस तरह की ऑर्गेनाइजेशन है और कि क्या कमियां रही इस WHO द्वारा इस पूरी पैंडेमिक को रोकने के लिए, और कौन से ऐसे स्टैंड पॉइंट्स थे जिनसे WHO इस प्रॉब्लम को और बेहतर तरीके से रोक सकता था और बेहतर तरीके से कंट्रोल कर सकता था। I'll not go in factual details of this issue, but WHO को समझने के लिए और WHO की कमी को समझने के लिए पहले हमें WHO का स्ट्रक्चर समझना चाहिए। WHO is an United Nations part organization which is specifically designed to control pandemic, outbreak of viruses, bacteria and other form of illness, other form of communicable and non-communicable diseases, issuing guidelines for global action and also regional action and country-specific actions. So the biggest problem with WHO is WHO was formed to be a reactive organization, and WHO has always reacted for some issue, whether it is a cholera outbreak or whether it is a outbreak, polio eradication, and it is always a reactive organization because WHO do not have any investigative body of its own. So it depends. It is a very reactive organization, generally reacts on a problem that has already emerged. You know, this everyday press conferences that Trump holds at his White Office, like White House Oval Office. In that conference on 15th April 2020, he said that we will halt all the fundings to WHO. And then onwards, like Tedros, who is the head of, rather Director General of WHO, has also responded that you are making it politicized. We should not politicize it. So it all started from there. So first of all, we should see what is WHO funding and how WHO gets its fund. Actually, there are three bodies that fund WHO. Primarily, it is done by the member states. Member states means all the states who are the member of WHO. Then the other part of the funding comes from the philanthropic organizations like Melinda Gates Foundation, Save the Children, and any such organizations like that. And then the last type of funding comes from international organizations like the United Nations, European Union, and other such organizations fund that. And if you see the budget of WHO, which is available on the site, you can go and see that yourself. Like almost 35% of the funding comes from the member state, and around 30% funding comes from these philanthropic organizations, charitable organizations like Melinda Gates and the things I've talked about. Other 20 to 22% funding comes from international organizations like European Union also funds, and United Nations also funds. So the problem here is that it is a very evenly divided funding. And when you see that there is also another type of funding when there is a voluntary funding, that all these fundings are voluntary. Any state can say that this year we will not be able to fund, or we are not going to fund because we are not agreeing to WHO's policy, or we'll stop the fund, as it happened with Donald Trump saying that we will stop the funding. So it all started like that. The funding structure is something like that. If you go in details of the funding, there is like the total budget of WHO is 5,623 million US dollars, and around 956 million dollars is from assets contribution. 4,328 is from specific voluntary contribution. Majorly comes from member states and philanthropic organizations. There is a $160 million funding for voluntary contribution and around $180 million funding for pandemic control and other things. But among all this data, you should see certain key factors. You should see how much funding is coming from American government. American government is contributing more than 15% of WHO funding. And when you analyze it in a number, it is $553 million. $553 million are funded from United States. And United States is also funding from other philanthropic organizations of United States, like Melinda Gates Foundation funds around 10% of WHO. Rotary International, it's an international philanthropic organization, but huge contribution to Rotary International comes from Europe and America, and which is also funding around 5% of total WHO structure. And that's how there is a unique funding structure in which you would get this thing that around 30 to 35% of the funding of WHO in last few years has come from America. So if America is going to stop the funding, it will raise substantial block to the expenditure of WHO. Other fundings are there, like World Bank funds 3.4%, UNOCHO funds 6%, European Union funds 3.3%, United Nations fund 5%. But the substantial amount of funding is coming from America. It is that substantial that you will, when you compare it with India, India only funds 1% of total WHO budget. So the maximum funding is from America, and when now America is stopping the funding, it's a big jolt. And I was just going through Australian news. Australian health minister has also said something grave about WHO, and we will reconsider WHO funding. They have said that. Norway has also said the same thing. So the same sentiment is coming from America, from Europe, from Australia. So this is a very typical situation for WHO. Why and how WHO has reached to this situation, that you need to understand the way in which WHO funds. Like polio eradication is a primary program of WHO. WHO funds more than $1 billion US for that. Whereas the outbreak prevention, that like you have seen the corona, there was Ebola, there was SARS, there was another viruses like HIV and all. So outbreak prevention, it is only $225 million. So you see that outbreak prevention is of 1/4 to a disease which has been established like polio eradication. That leads me to my first point that I made, that WHO is specifically a reactive organization. ये बहुत बड़ा एरर है WHO के सेटअप में कि WHO जनरली उन चीजों पर काम करता है जो डिजीज ऑलरेडी स्प्रेड हो चुकी हो, जिनका आउटब्रेक कंट्रोल करने में इसका बहुत अच्छा रिकॉर्ड कभी नहीं रहा है, whether it has been SARS or whether it has been Ebola or whether it has been any other disease like HIV, how it transmitted from Africa to all over the world. We all know this thing. So the problem here is that the organizational structure of WHO is itself faulty, because it is not a impromptu organization or proactive organization or preemptory organization. It do not has an investigative body जहाँ पर ये अपने साइंटिस्ट या अपने डॉक्टर्स भेज सके एक impartial inquiry कराने के लिए कि where outbreak has occurred. Like in Wuhan, आप विश्वास नहीं करेंगे, it took almost 2 months for WHO to send its doctors team to Wuhan to conduct a non-Chinese survey. It was the first non-Chinese survey to Wuhan's wet market. It was very late because WHO in its organization, it's not a preemptive organization, it is a reactive organization. And same goes with its funding. Like if you see the funding structure of WHO, most of the money goes to Africa, like 32.4% of the money goes to Africa, the Mediterranean, which includes China, takes 27.3%. Operational costs are 20%. South and Southeast Asia, like India, comes within the South and Southeast Asia club. It takes 8%. India's total funding is around 1.2%. So India gives 1%, takes back 1.2 to 1.5% of total WHO spending. Europe takes Whole of Europe takes 6.5%, Pacific takes 5.6%, America takes 1.2%. So interestingly, America is contributing 30 to 35%, but whereas it is taking only 1.2%. So Donald Trump is getting angry and booing the situation to WHO is quite visible and quite clear. But the thing is not like that, because controlling an outbreak of a virus or maintaining global health is not a question for one state. Like whoever is the richest state shall contribute more. Now, so this is what about funding. Until unless you don't understand the funding and organizational structure of WHO, it is really difficult to find out the flaws in WHO's system. Now, so second part of my talk would be how WHO functions. WHO has a very stringent procedure, so I'm not going into detail with that, but I'll be telling certain key elements of how WHO functions. WHO has a headquarters in Geneva, and they conduct an annual general meeting. They call it World Health Assembly, in which delegates from all member states come and discuss the agenda prepared by the executive board. Now, this executive board is really important. This executive board is 15 to 25 members body which prepares an agenda that how WHO is going to implement annually and annually plans, 5 year plan for WHO. Now, you will see there is an amazing anecdote for this, that America has not sent an officer for the executive board since 2015. So the executive board decides three things. First is WHO policy. Second thing is appointment of director general, and third thing is review and approve the budget of WHO. Now, all three things are important because in WHO policy, appointment of DG and review and approval of the budget, China plays a very vital role. The current Director General Tedros was appointed due to Chinese pressure. And the important thing is that the person against whom he was competing was an Indian nominee. So how Indian nominee got defeated and how Chinese patronage played a very vital role in appointment of the DG of WHO, the current DG of WHO, Dr. Tedros, is very questionable. And we should ask serious question that under what circumstances it has happened. World and global organizations have ignored WHO. They have never thought that DG or Director General of WHO could be that important post. But it is really important when the situation is something like this. So the current DG was appointed, Dr. Tedros, and he has been saying that it is that we should not do politics. We should not do politics when it is about pandemic control. But he should also see that how he got this post. He also got this post because of Chinese influence and politics and arm twisting. So it is really clear. You should see the Tedros, the current DG's background. He was the Ethiopian health minister from 2005 to 2012. Then he became the foreign affairs minister from 2012 to 2016, in which he got in touch with Chinese agency, and that's how he was nominated in 2017. And actually, it was China who capitulated him at the post of DG WHO. And how he helped China is a critical issue, because you see, on 14 January, WHO has said this thing that there is no evidence for human-to-human transmission of this virus. It's a very serious thing. 14 January is like in later part of 2019. There was certain evidences of outbreak of this virus, but still WHO sent a statement that there is no evidence for human-to-human transmission. Believing on Chinese report and believing on Chinese propaganda, and Chinese are really good at portraying or portraying an image what that they want to predict. Like not believing in Dr. Li Weliang's story. Li Weliang was the first orthodontist, the dentist who revealed the story that there is a new virus coming, new SARS virus is coming, which is affecting uh, respiratory syndromes and creating respiratory problems. It's like pneumonia, like problem. We know how he was sidelined, how there was a charge of spreading rumors, false rumors. Nowadays, I was reading a Chinese report that he is considered as a martyr. So it's way too late. So ignoring Chinese, certain Chinese whistleblowers report to WHO. Uh, just imagine 20th January, there was no advisory from WHO where there has been a huge virus outbreak in China. There were more than 100 people affected outside China. Even then, there was no advisory from China, from WHO that we should put a travel restriction. Whereas before that, he said that the DG Tedros said that we should not restrict trade and uh, communication and transport across the nations towards or from China. The reason being this virus this virus is not human to human transmissible, and China has controlled it very well. It took almost 2 months for WHO to declare that this issue is a pandemic. So this is the situation that WHO has put into itself. There is huge organizational errors, there is huge financial errors, there is huge strategic errors to WHO. Now, how to blame, when to blame, and what is the structure of blame that we can put into China? WHO is our question. But before understanding WHO, we should understand that what is the role of WHO and how WHO helps for analyzing. Like there are certain mistakes WHO has committed, no doubt about it. First mistake what WHO has committed is a lack of promptness. Now, whenever there is a outbreak of a virus, it is mandatory that World Health Organization should be very prompt for that virus control, which was not seen in the case of WHO. There was no advisory, there was no restriction on travel from WHO side until it became such a huge pandemic. Like it took WHO to decide it a global pandemic when there were more than 100 cases outside China, more than 100 reported cases. Like there are certain key things which China ignored. Like sorry, WHO ignored. Actually, WHO praised China for sharing the genome of the virus. But if you see that they shared the genome of the virus after 14 days of the outbreak, and genome of the virus is easily like you can decode the genome of the virus within 2 or 3 days. China specifically delayed in telling the world the genome of the virus. More than 3 weeks it took WHO to send a advisory that we should put a travel ban. Before that, so many countries has already put ban, like Taiwan has put a ban, Australia has put in ban on travel from or towards China. But imagine if WHO has acted promptly, we could have saved so many lives, so many, so much of money could have been saved, so many lives could have been saved, and the world would have been in a very different situation. तो ये एक कलंक है WHO के माथे पे जिसको WHO को धोने में सदियां लग जाएंगी. With this remark that it is not human to human transmissionable, this remark that you don't need to panic, the situation is under control, this remark that there is no need of travel ban, these are certain things which shows the immaturity of the organization. And this immaturity could be politically influenced because Tedros was a Chinese prompted candidate for DG's position. The world is not aware about that. The second thing, second mistake that that WHO did is it was really very much China centric. Like when there was an outbreak of virus in January, Tedros visited China, Beijing, met Xi Jinping, shook his hand, and then came back to WHO's headquarters at Geneva and praised a lot about China, how China has controlled it, said it has played a global role in controlling the pandemic, how China help the world in not spreading the virus. This all is utter nonsense what Dr. Tedros was saying. It shows that it is too much China centric. It was believing the Chinese propaganda intentionally or unintentionally. Now China is a country which believes in putting a propaganda, whether it was Deng Xiaoping's idea of following right while saying left, how Deng Xiaoping changed the country, look like a leftist country while working on capitalism. It's in front of us. So there is a very famous line by Deng Xiaoping that it does not matter that cat is black or cat is white. Cat has to get in chase and get the mice. That you have to have capitalism if you need to grow. It does not matter it is left centric or right centric. So believing Chinese propaganda is another mistake or a brutal mistake and a key mistake on WHO's side, that it has not uh, intentionally or unintentionally audited the Chinese report. And there is also one problem here that WHO do not have an investigative machinery of its own. So it depends upon the data which are there from different states. So member state provide a report and they believe it, but they should have done a broader, a much more impartial and independent study of Chinese data, because Chinese data have always been questionable. Like 2002 SARS virus outbreak, still there has to be question asked how this outbreak has happened in China. And you see last pattern of last 40, 50 years, like 6 or 7 decades, maybe you could say, that all the viruses are coming either from China or originated from China, outbreaks in China. So Chinese propaganda theory is there, and why WHO has not gone through it? It's always a question. Why WHO has not put a restriction on travel or declared pandemic way too late? It has not given world a chance to react on the issue. That is a main area. That is a mistake that China did. The incompetence of WHO in conducting an impartial study of COVID is also an issue. But there is also one other mistake of China which I really want to point out, that people are ignored, that it's policy error. Like China has been saying this policy that the only way to control this virus is test, 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 and test. There has to be increase in global testing. Although India has not followed this formula, reason being is that from where we will be doing tests. These test kits are generally Chinese import kits, and the world is dependent upon Chinese import kits. How it is possible for a world to do tests other than importing kits from China, and importing kits from China which may be defective, as we have seen in the case of Italy, we have seen in the case of Germany, we have seen in the case of Pakistan, we have also seen in the case of India that China is sending the defective kits, or certain kits, rapid action kits are defective. And again, it is all tenders going to China and China's big pharmaceutical company. So whatever it is, test formula is not that good, because India has not done that many testing. What India has done is testing only in red zones and orange zones, which helped India because with more testing you will get more positive patients. Is not a foolproof criteria, because India is testing in the areas which are more hit by corona. Still, India's growth is not as big as the countries who are testing more. So testing has no connection with the control to the virus outbreak. Rather than putting a country into lockdown or huge travel restriction, social distancing, physical distancing is better criteria to control the pandemic because it directly relates to how the pandemic has spread. So, under this situation, WHO roles is really critical. Another critical area of WHO role is not analyzing the impact of asymptomatic COVID patients. So, WHO till date do not believe that there is a asymptomatic COVID patient where there are evidences in India, there are evidences in China that there are asymptomatic COVID patients. There is also one mistake from WHO, which is about the second wave of COVID. So there is no advisory from WHO side on second wave of COVID wherever it is emerging, like in Italy or in Germany or in China. So these are the fine. These are like I've highlighted more than 8 or 9 mistakes, around 8 mistakes that WHO has committed. But we should put that into theory that how WHO has committed this mistake. Now WHO's role is in 3 dimensions. First dimension is pre-pandemic. In pre-pandemic, where the pandemic has not started or outbreak just has happened, WHO's role is always questionable. Whether it was in SARS-1 or SARS-2 or Ebola, there was no preemptive struck from WHO. There could be a factor that WHO is incompetent to do this. Reason being that WHO is so much dependent upon country's own assessment of the problem. So that is one area WHO role is always questionable since its inception in pre-pandemic disease control. Now, there is also second side during pandemic, which the situation which we are in. We can say that WHO's track record. I'm not saying that this thing in respect of COVID. I'm saying WHO's total situation. So during pandemic, I could say that the role is below satisfactory or somewhere satisfactory. I'm not saying regarding COVID. What I'm saying is regarding the situation we are regarding the situation of WHO. So it has been satisfactory, but it is very much below satisfactory when we understand the situation of COVID. Now, because of its non-clarity about guidelines. For example, take one example that about mask. WHO's advisory is there that the person who are not affected or do not show symptoms should not wear mask. But if everybody is wearing mask, we can reduce the risk of corona to 85 to 90%. So this is a very simple technique which WHO should have given to all of the world or distributed masks to all over the world because it is generally from nasal and oral cavity that viruses we ingest. So this is one mistake. Take the example of Taiwan. Now Taiwan is not a member of WHO because of Chinese opposition because China do not consider it even a state. So Taiwan issued was the first country to put a ban to travel from and towards China. In this situation, Taiwan also said that we will distribute free masks to all the people, and people should wear 1 layer or 2 layer or 3 layer, whatever form of mask available. That helped Taiwan to be the lowest growth rate of corona. And you would be amazed that Taiwan has sent an advisory to WHO way before this thing that it was in, I think it's December 26th. And again, one advisory was sent from Taiwan to WHO on 10th January 2020 that we believe and we have reason to believe that this virus is human to human transmission. It can transmit from one human being to another human being. WHO has ignored the report of Taiwan, maybe under Chinese pressure or something else. But this Taiwan response or the story of Taiwan tells us that how inconsiderate WHO was during and before the pandemic. Now, there is also third role for a WHO, which is after pandemic. We can say Overall, since 1948 till now, WHO's role is satisfactory. But with respect to Corona, we have our doubts because of the second wave coming, because of not taking preemptive and reactive actions. We could say that the current situation of WHO is really critical, and critical to the extent that it is not realizing its mistake. Now, there are two ways to reform WHO, and both are contradictory ways. One way is that we should give more power and more funding to WHO so that it could establish more reactive organization, more impromptu organization, more preemptive organizations. More doctors and more teams should be there who could go to countries and conduct a study. But there is also another side of the coin that China and North Korea are such countries, like if there is an outbreak of a virus in China, and if China is not allowing the team of WHO to conduct a study, or if WHO is functioning under a big country like China, who is the second biggest donor after America to WHO. So this situation will be really, really critical, that how these countries have so much of domination about these ages old bodies. And that's why I say that all the organizations that have been made, this Kelsenian model of these organizations, or this modern model of of international organization, are born from the dust of Second World War. ये द्वितीय विश्व युद्ध की राख से बनी हुई ऑर्गेनाइजेशन है, और इनमें बहुत ज्यादा जरूरत है प्रोसीजरल, ऑर्गेनाइजेशनल, स्ट्रक्चरल चेंज की. एंड अगर ये चेंज दिखेगा, then only we could realize that these things could improve in the way we want, in the manner we want, and that is the biggest crisis of the situation. The biggest crisis currently is that China is China, America, Germany, all these big countries have so much domination over these organizations. See the situation of WTO or World Intellectual Property Organization or WHO. They are under so much of domination from these big states. So much of politics is involved in these big states, like the appointment of Ted Ross, the current DG, like how WHO was following the Chinese pattern, how it was supporting China in controlling the pandemic. So this is the situation. And in this situation, we also should analyze the things which will come after or during, when we are about to end this corona pandemic. There would be a propaganda war. Propaganda war means when America will say that this virus is impromptu from China, and China will say that this virus is impromptu by America, and so many others. And in this impromptu war, it is really important that we gather and we get information which are more needed, much more vibrant. And for that, discussions like these, reading issues regarding WHO, analyzing WHO is really important. And for that, I'm really thankful for all the organizing team for giving me space to speak on WHO. I think I have 5 or 6 minutes, so I'll speak a bit on how would be India's response to this pandemic. I believe that there are only three ways to respond to this pandemic. The first way is to get a medical cure for this problem. You see how remdesivir, the drug which was evolved for Ebola, has been reactive towards this issue. You also seen a successful use of plasma therapy. I'm really happy that the hospital in Lucknow, the KGMU, is also operating this plasma therapy, the first government hospital to operate the plasma therapy in India. Then we have also seen the impact of hydroxychloroquine on pre-COVID exposure patients. So there are certain good news from India. We have also seen the way India has controlled it. There are two very important models. One is Bhilwara model of Rajasthan. Another one is a model in Kerala, Kojiwar model of Kerala. And both have done very well. We have also seen seven sisterly states, how they have responded, how Andaman has responded. So there are certain good news from India, the way India is responding to this problem. But for medically curing it, a vaccine is a must. and vaccine will evolve. I'm a positivist, I'm an optimist, so I believe that this vaccine will arrive soon. But how that vaccine should be given to such a huge number, and can India procure that many of vaccine, or will India remain into social distancing in coming few years? I do believe that social distancing shall be the, or rather, I would not say social distancing. Socially, people cannot be distinct, but physical distancing shall be the norm of this country. This public spitting and all these not following the oral and hand hygiene shall be the criteria how we can medically cure, at least slow the growth of this pandemic. The second cure for India, the second way India would going to handle this problem is, you see the approach of India regarding economy. Yes, economy would be under a huge pressure after this thing. It is really important to revive the economy after lockdown. We should see and assess how much is the loss. My heart goes to the poor farmers, poor workers, migrant laborers who have traveled and who have put themselves into risk, who have very less resources. And I'm really looking forward that how government is going to respond to this. This certainly cannot be done by the tax report, the infamous force report that is submitted by IRS officers to finance ministry. That is heavy. That is to lay down heavy taxation, because that will bring a vicious circle into economy where the money, the tax, more taxation economy are never good for the world. We have seen this thing. And the third cure for this is the geopolitical cure. The geopolitical cure is one field where I feel that India can play a very vital role, because we are leading to the world of the new multilateralism. And in this new multilateralism, it is really important that India should take its position, India should take its stand. India is very cautious. It has not said anything about WHO. It has not said anything about China. It may be right for the time, but there would be time where India has to take a strong hold, a strong position in the new geopolitical world and in the new multilateral world. But I believe that the new multilateral world would not have such organization like WHO the way it is working right now, and for sure that the new multilateral world would not have a director general like Dr. Tedros, the way he has responded to the problem. So, as countries are blaming Tedros, I'm also on their side that it is WHO and Dr. Tedros were at the position where they could have saved so many people, and they have failed to do that. It is a